Hello, I'm Mira, Dr. Neil's assistant from Anaheim Eye Institute. If you're watching this video, it's probably because you are considering having refractive lens exchange and trifocal lens implants. By now, you probably understand how these lenses work and how they may reduce and eliminate your need for glasses. But there's still one very important question. How do you know if you're actually going to like the vision? That's a completely reasonable question. After all, this is a permanent decision. You deserve to know as much as possible before moving forward. For years, that was one of the biggest challenges in refractive surgery. We could explain the advantages of trifocal lenses. We could show pictures. We could describe what patients experience. But we couldn't actually let you experience that vision for yourself before surgery. That has now changed. Here at Anaheim Eye Institute, we offer something we call our Vision Test Drive. Using a remarkable piece of technology called the Simvis Gekko, we can simulate many of the visual characteristics of a trifocal lens before it's ever implanted in your eye. Think of it this way. If you were purchasing a new car, you probably wouldn't buy it without taking it for a test drive. The same idea applies here. Before making a permanent decision about your vision, wouldn't it be reassuring to experience what that type of vision actually feels like? That's exactly what this technology allows us to do. When you look through the Simvis Gekko device, you'll be able to experience how your vision will function at different distances using a trifocal lens implant. You'll notice how your eyes transition between near, intermediate, and distance vision. You'll also have an opportunity to appreciate some of the trade-offs that come with this remarkable technology. One of those trade-offs is contrast or crispness of the vision. Because trifocal lenses divide light into multiple focal points, the image may not appear quite as crisp as it does through a traditional single-focus lens. Some patients notice this and others do not. That is why it's important for you to try it first. Most patients describe the clarity as being approximately 90% as sharp, while gaining the tremendous convenience of seeing at multiple distances without constantly reaching for glasses. The second characteristic is nighttime halos. Because of the optical design of trifocal lenses, lights at night often appear with rings or halos surrounding them. These halos are completely expected. Most patients tell us they become much less noticeable as their brain adapts, but again, it's important for you to see this through the Simvis Gekko for your FALF. One of the things we appreciate most about the Simvis Gekko is that it allows patients to experience these characteristics before surgery rather than learning about them afterward. That leads to much more confident decisions and much happier patients. This technology is incredibly advanced. It provides a remarkably realistic representation of the visual experience and is currently the most sophisticated tool available anywhere in the world for helping patients evaluate trifocal lenses before surgery. In fact, this technology was developed by researchers in Spain and has only recently become available in the United States. Last year, Dr. Neil traveled to Spain to work directly with the developers, learn the technology firsthand, and bring it back to Anaheim Eye Institute. At the present time, we are the only practice in the state of California offering this technology to our patients. Our goal isn't to convince you that a trifocal lens is right for you. Our goal is to help you make the decision that's right for you. If that means choosing a trifocal lens, wonderful. If it means choosing a different option, that's perfectly fine as well. What matters most is that you make your decision with confidence and with a clear understanding of what to expect. If you'd like to experience our Vision Test Drive, we'd be happy to schedule a Simvis Gekko evaluation and answer any additional questions you may have. Thank you for taking the time to learn more, and we look forward to helping you achieve your best possible vision.